Welcome back to AM Kentucky. Each January, many of us set goals for ourselves to be healthier in the new year, eat better, lose weight, and so on. Well, joining us right now is Dr. Raphael Nwanguma. He's a bariatric surgeon with MedCenter Health to talk about different options when it comes to weight loss. Thank you for being here.
You're welcome.
Well, yeah, there are so many different ways to achieve weight loss, but sometimes I guess people they hit a wall with certain diets, and so you have seminars that talk about bariatric surgery.
That's correct. So first of all, dieting does not work in the long term. Most people that diet almost invariably regain the weight. So we offer surgical weight loss, which is more permanent way of weight loss. And we do have seminars at the MedCenter Health the first Thursday of every month.
Okay, and what can we expect during some of those seminars?
So during the seminars, we give patients information about the disease itself, which is obesity, and what you can do to overcome it. Okay,
and like you said, diets don't always work because the weight tends to come back. So what is surprising about some of these, or the weight loss surgery, that people think, oh, it's going to be worse than it is? What are some of the surprising things?
Yes, so you mentioned it. So surgery that we offer are the gastric bypass and gastric sleeve, and we do them very safely. We do it in a minimally invasive fashion. People can go home the next day if you had the gastric sleeve, and a couple of days in the hospital if you had the gastric bypass. So patients come away thinking that it's too morbid, but what we do, patients recover from, very, very soon. Patients are able to go back to work within 7 to 10 days.
That's pretty amazing. So what should someone consider when thinking about weight loss surgery?
Well, the thing to think about is your weight first. So if you weigh about 75 to 100 pounds or more than you're supposed to weigh, you should begin to think about that because it's hard to lose that weight, as we mentioned, on your own. So if you weigh that much over your supposed weight, you should talk to your primary care doctor or your nurse practitioner and get your BMI, 3 letters, BMI. It stands for Body Mass Index. The BMI takes into account your height and your weight. And if that BMI is over 35, you should come see us.
Okay, so that's a good number to remember. So what are some of the long-lasting effects of having this surgery?
So you do gain some of the things that you lost, like mobility, the ability to move around. Patients are able to get rid of diseases that are common due to obesity, like type 2 diabetes, hypertension, sleep apnea, some heart disease, some lung diseases, and others. So when you have this surgery and you lose weight, those diseases get better, and you can go for a long term. If you do the right thing, you may not regain that weight.
Okay, and let me ask this. I know we have to wrap up here in just a second. When should someone seek weight loss surgery? What should they go through first, like diets, or when is someone a prime candidate?
Well, first thing is once your BMI is 35 or higher, come see us, and we educate the patients. We explain to you what to expect, and going from the time you come in to the time you have your surgery. And after the surgery, we follow up with our patients for a lifetime. So we never discharge anyone from our practice. So we see you throughout the lifetime. If you fall by the wayside, we could always try to get you back.
Okay. All right. Well, Dr. Nwanguma, thank you so much for being here and telling us all about weight loss surgery. And if you want to learn more about it, there's much, much more, I'm sure, that goes along with it. Seminars may be right for you. And the seminars, again, are on the first Thursday of each month, and it's at the WKU Health Sciences Center. For more information on the seminars or anything else, call 796-6333. We'll be right back.